Hi, Mr. Polson. How are you today?
Hi, how are you?
Very well, thank you. Dr. Smith asked me to see you. You might remember me from last year. I'm Lori Signorelli. I'm the behavioral health clinician who works with Dr. Smith and his patients on health-related behaviors like lifestyle things like diet, exercise, alcohol consumption, things like that.
Yep, I remember you.
So Dr. Smith asked me to speak with you a little bit today. He told me that you had been found to have some raising blood sugars and that he has you in the pre-diabetic range. Am I correct?
Yep, that's right.
He did ask me if I could look and speak with you a little bit about your lifestyle behaviors, especially as they related to alcohol usage, because he shared that you'd had some discussion during your visit.
Yep, that's right.
Okay, so are you all right if I ask you a couple of questions?
Yep, sure.
All right. I am going to ask you a few questions from a tool known as the ASSIST tool. This is an evidence-based interview that thousands of people have taken, and it helps us gauge where you're at in terms of your consumption of any alcohol or drug or tobacco-related things. So it's just about 8 questions. I'm going to get started, if that's all right with you.
Sure.
Good. Thank you for agreeing to take part in this brief interview about alcohol, tobacco products, and other drugs. I'm going to ask you some questions about your experiences of using these substances across your lifetime and in the past 3 months. These substances can be smoked, swallowed, snorted, inhaled, injected, or taken in the form of pills, like on this drug card here.
Okay.
Some of the substances may be prescribed by a doctor, like amphetamines, sedatives, pain medications. For this interview, we will not record medications that are used as prescribed by your doctor. However, if you have taken such medications for reasons other than prescription or taken them more frequently or at higher doses than prescribed, please let me know.
Yep.
While we're also interested in knowing about your use of various illicit drugs, please be assured that information on such use will be treated as strictly confidential. So, I'm going to ask you the first question, and here is a response card that helps you know what kind of answers we're looking for. In your life, which of the following substances have you ever used? Tobacco products.
No, never.
Alcoholic beverages, beer, wine, spirits.
Yes.
Okay. Cannabis, marijuana, pot, grass, hash.
Yes.
Cocaine, coke, crack, etc.
Never.
Amphetamine-type stimulants, speed, diet pills, ecstasy, etc.
Never.
Inhalants, nitrous, glue, petrol, paint thinner, etc.
Never.
Sedatives or sleeping pills, Valium, Seropax, or Hypnol, etc.
Never.
Hallucinogens, LSD, acid, mushrooms, PCP, Special K, etc.
Never.
Opioids, heroin, morphine, methadone, codeine, etc.
Never.
Other. Any other drugs?
Nope.
That you can go. Okay. So, in the past 3 months, how often have you used the substances you mentioned? Alcoholic beverages, beer, wine, and spirits.
I would say daily.
Okay. And marijuana, cannabis, marijuana, pot, grass, hash, etc.
I used it a little bit in high school way back when. I never really enjoyed it, never got much off of it, and I haven't used it since.
Okay. So, and never then for that. During the past 3 months, how often have you had a strong desire or urge to use alcoholic beverages?
Again, daily, I would say.
Okay. During the past 3 months, how often has your use of alcoholic beverages led to health, social, legal, or financial problems?
I would say monthly.
Monthly, okay.
Mm-hmm.
During the past 3 months, how often have you failed to do what was normally expected of you because of your use of alcoholic beverages?
Again, I would say probably on a monthly basis, maybe 2 or 3 times in the past 3 months.
Okay. Has a friend or relative or anyone else ever expressed concern about your use of alcoholic beverages?
Yeah. Again, on a monthly basis, probably I would say my wife and I have gotten in some discussions about it. She's a bit concerned that it's maybe presenting a little bit of an issue, and I've also had on a few times missed work or come in late to work, so it has to a small degree impacted my work a little bit as well.
Okay. So that would be yes, in the past 3 months you have had these kind of
Yes.
issues with
Mm-hmm.
people having complaint. Have you ever tried and failed to control, cut down, or stop using alcoholic beverages?
Yes, I have. Probably again a couple of times in the past 3 months, I would say.
Okay. Have you ever used any drug by injection?
No.
All right. Thank you. I'm going to take a minute to do your score here. And I'd like to take a moment to discuss the results with you.
Yeah, sure.
Okay. So in the test, you let me know that you drink on a pretty much a daily basis, and that in the past 3 months, you talked about it being a monthly basis, that you've had issues with your wife maybe expressing some concern,
Mm-hmm.
and that you've had some issues with lateness or maybe calling in to work as a result of
Mm-hmm.
your daily usage of alcohol,
Yeah.
correct?
That's correct.
Okay. Well, this is where the assist tool scored you. And this is based on looking at all of the drugs. All of the drugs, tobacco, cannabis, coke, amphetamines, etc., with the exception of alcohol, you scored as needing no intervention. You're fine. Your usage is healthy for all of those substances, okay? Then for some people, maybe it's approaching a different limit, and we might recommend a brief intervention.
Mm-hmm.
But Mr. Polson, you actually scored on alcohol a recommendation for more intensive treatment. This is based on scoring 41, which is over the limit. It's 27 and above scores for more intensive treatment. So one of the things, that I would like to ask is this surprising to you?
No, I was beginning to have some doubts.
Okay. Well, what I would like to do is 2 things. I would like to talk with Dr. Smith a little further about the potential, because you are a daily drinker, to see if he thinks that medical detoxification would be a recommendation followed by treatment, or if he feels you could go straight to treatment. Now that would be our recommendation based on the results of your test. I do want to talk to you a little bit and show you. Now, you mentioned beer a couple of times during the interview. Do you drink any other type of liquor ever?
No, it's just beer, just to kind of take the edge off, sort of thing. At the end of the day, is what it's all about.
Okay. So, just focusing on beer. There are limits. There are what we call healthy drinking limits. So for men, that's no more than 14 drinks in a week and no more than 5+ drinks per occasion. That would be a 2-hour period. So for beer, one 12-ounce beer at 5% alcohol equals 1 drink. If the alcohol level in it climbs like 6 to 8%, that same 12-ounce beer is going to be worth 1.5 drinks. So where would you say you're at in your consumption really on number of drinks on a daily basis?
On a daily basis, I would say at least 2, maybe 2 to 3 a day, I would say, if we were to average it out.
Okay. Are there times you go over that 14-drink limit in a week, or 5 drinks more on occasion?
There are occasions, yeah. You know, I'll get together with my friends, maybe, you know, so.
Okay. Well, for these reasons, our recommendation would be for you to get some assistance. Now, I guess I want to ask you, having shared this information with you, what do you think about that? Do you feel, hearing that information, that you might like to make a change? I also want you to keep in mind that there are health effects of using alcohol. It increases blood pressure, increases cholesterol, increases blood sugar, which might be of import to you because you've been diagnosed as pre-diabetic.
Yep. Yeah, I am very ready to get started with the next step. Okay.
Well, you said you're ready. So let me just show you a little thing here. It's called a readiness ruler. It's scored 1 to 10, 10 being yes, full steam ahead, let's go, 1 being no way, not at all, and all the numbers in between being something, with 5 being right in the middle. So how ready are you to make a change at this point?
Maybe 8.
Okay. Now, you shared during the course of the assist that you had tried a couple of times. Was that on your own?
Yeah, that was on my own, and it didn't really work.
So with that as your history, how confident are you that you can make a change?
Well, based on what we just discussed and, you know, seeing Dr. Smith and this pre-diabetic thing, I'm very motivated.
Okay. Would you be willing to make a plan with me that you would go back to Dr. Smith? We would discuss with him whether a detox would be recommended to help you prevent withdrawal, and whether or not that's recommended, whether you would agree to outpatient treatment at this time.
Yes. Yep.
Okay. And then to follow up with me in 1 week's time.
Sure. Yep.
Okay. So I will make that outpatient treatment appointment for you right after we get to speak with Dr. Smith right now. Okay?
Very good.
All right. And then we'll set up an appointment with me. Thank you very much.
Thank you very much.
Take care.